Magnesium is an essential mineral in the body that plays a significant role from nerve functioning to muscle functioning, bone development, blood sugar control, even heart rhythm consistency. And over the years, magnesium has now also received increased attention about its possible impacts to help people to have more healthy sleep and to get better quality sleep. Researchers actually show that close to 50% of adults and children currently in the United States may not consume enough of the magnesium to give their bodies what they truly need. And we know that magnesium can be found in foods such as nuts, leafy greens, whole grains, dairy, and soy products. We find that for magnesium specifically impacting sleep, higher levels of magnesium within the body are associated with better sleep overall, longer sleep times, and less tiredness during the day. When they're looking at older adults, they were seeing that it could help them to even fall asleep faster and stay asleep without waking up as many times throughout the night. There's been research beginning to look at magnesium in insomnia and also looking at magnesium in restless leg syndrome, seeing that individuals taking magnesium for leg cramps, it could potentially also help with less symptoms related to restless leg as well. It is important when we talk about magnesium in general to recommend that there are certain things to take into consideration when picking your supplement. I do want to remind individuals that I am not a prescribing provider, so I am not providing you with medical advice in terms of telling you exactly what to take and do, but sharing with you what we know from the research and what behavioral sleep medicine specialists and medical doctors are typically prescribing currently in the course of magnesium. What we are finding is that magnesium comes in many forms, and so there are some that are going to work better to help with sleep and relaxation than others. Specifically right now, providers are recommending magnesium glycinate as the one that is going to show the best impacts and to be absorbed as the best manner for the body with the least amount of side effects. There are other types of magnesium, for instance, magnesium citrate, that is very common in stool softeners and is not going to give you the same benefit as you want versus having that runny tummy and impacting you in the middle of the night. There are other types of magnesium as well that we want to be cautious of that many times we can see out there. Carbonate, magnesium oxide, so just making sure that you're getting the type that is typically recommended by prescribing providers, that magnesium glycinate. From a dosage standpoint, again, you would want to work with your doctor to see what's ideal for your body, but right now typical recommendations usually range around 350 milligrams or less to avoid potential side effects. And it's important to note that magnesium is not going to be currently regulated by the FDA. So you're going to want to make sure that you would get a brand that endorses and uses third-party testing so you can make sure that you're getting exactly what it is that you're wanting to get in that supplement and that there aren't other fillers or things that are in there and that the dosage that you're expecting is what you're actually going to be finding. Lastly, many people will ask about potential side effects and if it's safe to use each day. For most people, it's fine for them to take it daily as long as they're taking 350 milligrams or less. But again, you would want to be checking with your doctor. And from side effects, when people are taking more than that 350 milligrams, that's where the research is starting to show negative side effects such as diarrhea, nausea, and abdominal cramping. Many individuals are finding magnesium is something incredibly helpful to help them to relax and sleep at night. Be well.